DPV Health acknowledges the Kulin Nations as First Peoples and Aboriginal traditional owners and custodians of the lands and waters where this podcast has been recorded. We pay our respects to elders past and present and anyone joining us today.
Welcome to the Escape the Vape podcast series created and produced by DPV Health. Young people deserve a healthy life where they can grow, learn and thrive. This sets a strong foundation for the rest of their lives. But the tobacco and vaping industry are threatening the health and well-being of young people through their addictive, harmful products. They have created non-therapeutic vapes with the intent of hooking a new generation on nicotine. To address this, DPV Health have created the Escape the Vape podcast series to educate adults in the community on the various harms associated with vaping and how to support the young people in their lives. DPV Health is one of Victoria's largest independent, not-for-profit community health organisations, providing an extensive range of health and wellbeing services in the cities of Hume, Whittlesea, Mitchellshire, Banyule and Darebin. Our purpose is to support you to live a happy and healthy life through the provision of inclusive, locally based health and wellbeing services. My name is Rebecca and I work in the health promotion team at DPV Health. I'm looking forward to hosting this podcast series and having meaningful conversations with our wonderful guest speakers. DPV Health acknowledges the Kulin Nations as First Peoples and Aboriginal traditional owners and custodians of the lands and waters where this podcast has been recorded. We pay our respects to elders past and present and anyone joining us today. Young people deserve a healthy life where they can grow, learn and thrive. This sets a strong foundation for the rest of their lives. But the tobacco and vaping industry are threatening the health and well-being of young people through their addictive, harmful products. They have created non-therapeutic vapes with the intent of advertising an addictive product that is designed to hook a new generation on nicotine. To address this, DPV Health have created this podcast series to educate adults in the community on the various harms associated with vaping and how to support the young people in their life. DPV Health is a community health organisation based in the City of Hume and City of Whittlesea. My name is Rebecca and I work in the health promotion team at DPV Health. I'm looking forward to hosting this podcast series and having meaningful conversations with our wonderful guest speakers. In today's episode, we will talk about the various support options available when looking to quit smoking or vaping, and we have two very special guests joining us. Riona Taylor is an AOD, alcohol and other drug, clinician from a service called The Zone. The Zone is an innovative, intersectional AOD support program based in Melbourne's inner north and west for young people aged 12 to 25 and their families. The Zone provides face-to-face support for drug and alcohol use, including vapes, drug education, peer support groups, assistance with managing withdrawals, and more. Thanks so much for joining us, Riona.
Thanks for having me.
We are also joined by Sabine Ostrowski, who is the State Manager of Quit Victoria. Quit provides direct support for people who smoke or vape to quit. Quit also supports doctors and health professionals to help patients quit and continues to advocate for legislation to protect Australians from the harms of smoking and vaping. Welcome, Sabine. Thank you for joining us.
Thanks, Rebecca. Great to be here.
Yeah, okay. So I'll start with asking you a question, Riona. How does the Zone or AOD clinics in general work? Can anyone refer themselves?
Yeah, in most cases, people can self-refer to AOD services. Most services have a website where a young person, their parents or a loved one can access information on how to refer. They may opt to call or send through a query online. General services that can help guide a person in the right direction can be services like Direct Line and Yoda. Young people and their families can access these supports who can provide service navigation to ensure that the young person finds the right support. Family Drug Support also has a 1300 line that can be accessed 24/7. There are really great resources online for young people and their families, such as the Australian Drug Foundation, the ADF, and they're readily accessible and quite easy to digest and read. Another great resource that people can access is Positive Choices. That's another great online resource for schools and families. And that has a lot of information on how to start the conversation with a loved one, which can sometimes be the hardest step. In our service specifically, through Odyssey Victoria, who is the organisation I work for, and the program that I work in, The Zone, you can contact a worker directly, such as myself. You can access our website or complete an online form or call our referral line. So there's quite a few different ways that you can contact us. So in the Zone program, we really try and ensure that we place ourselves in spaces where young people can meet us and access our services easily and efficiently. This is why for early intervention, especially around things such as vaping, we opt to outpost at schools and community events regularly to ensure that young people have the access that they need for information, support and strategies to reduce and cease their use.
Yeah, great. So I suppose once someone is referred to the Zone, whether that's a self-referral or a family or friend has done that, what does that process look like once they meet with you? Do you sort of set a plan on how the AOD process works?
Yeah, we provide a lot of information around how to access AOD services, the service system, and where they can access their own supports. We usually provide a treatment plan and support the young person and their family to set goals around
great.
the treatment.
Amazing. Yeah. Okay, so then what if someone lives far away from the service? How can they access support?
Many youth AOD services, they do have an outreach component. And that's to ensure that young people, say in regional areas, are able to access the support that they need. As we know, many young people reside in places that are limited in public transport, options for local services. As an example, in my catchment that I work in Human Macedon Ranges, very big. And that means we reach young people from regional areas. It's very often that I am out in Woodend, Lancefield, Rumsey, Gisborne, because we know that young people need to access that support somehow because it's such a barrier.
Yeah, great. Okay, so then Sabine, how does this compare to accessing online support such as through Quitline?
Quitline is a free telephone counselling service that Quit provides where you have qualified staff providing sort of information and support to people who might be interested in quitting, might be supporting someone else to quit, may have tried to quit several times and failed, and they are there to have an open conversation. The service is very non-judgmental and we regularly support people who come back after multiple quit attempts, and that's very normal. We are open from Monday to Friday, 8 to 8, and on Saturdays from 10 till 5. People can access Quitline by calling 13 78 48, and we really provide a sensitive service for people from the LGBTIQA plus community, as well as Aboriginal Quitline, which is our First Nations support, where First Nations staff provide culturally safe support. And in addition, if people aren't a bit coy about ringing, I think that's always a thing with young people, don't love to pick up the phone. I know with my own kids it's the same. We have different ways that people can access Quitline. So they can go to quit.org.au and request a callback. They can also access us through Facebook Messenger and WhatsApp and various other ways as well. But on the quit.org.au website, there's also lots of great information and stories that sometimes gives them the impetus to actually call in and make that call.
Yeah, great. Okay, so before people can access support, I suppose they need to be aware that they have an issue that they need to be sort of reaching out for help with. So, Riona, how might someone know that they are addicted to vaping so that they can then access support?
Yeah, I think when a young person is developing a dependence on any kind of substance, they might find themselves vaping more often. That could be daily. They could have started vaping with peers as more of a social thing, and they've found that they're starting to vape on their own. Thinking about vaping, trying to find a vape to use. I know for a lot of young people, especially that younger cohort, like 13, 14, they are really, looking for someone who they know has a vape so they can have, quote unquote, a hit of the vape. And a lot of young people describe, again, a word that's used often is like fiending for a vape. So they might find themselves engaging in activities as well that they normally wouldn't do to fund the dependence. That could be borrowing money or spending the money that they have on the vape instead of meaningful activities. That could even just be going to the movies with your friends. And they can also find themselves maybe spending time with peer groups that they wouldn't normally spend time with to have access to a vape or whatever it might be.
Yeah, and I feel like I may have even seen this on some sort of like quitting advertisements before, that it's often the first thing you do when you wake up and the last thing you do before you go to bed. That can be a real indicator as well. So, Sabine, what does this quitting process look like when we're talking about withdrawal from nicotine and things like that?
Look, I think that's a great question, Rebecca. The reality is that quitting looks different for everyone. We're all very diverse and our quitting journeys look quite different. But there's no doubt that nicotine is very addictive. We know that it stimulates the reward pathway in our brains, and so you get that dopamine release, and that's what makes people feel warm and fuzzy. But what we also know is that when you stop nicotine, then your dopamine drops and you feel a bit yucky. So often that can be you feel irritable, you feel anxious, you might be having cravings, may have trouble concentrating in school or doing other things. Sleep problems are very common as well, and people might feel a bit sad and depressed. But I think what's important to know is that's a real sign. Being able to recognise that is a sign that your body was addicted and that you're making a good change. And so those symptoms might peak sort of around day 2, day 3 after quitting, and then slowly drop off over time over the next 2 to 4 weeks. But what we do know is that it's a journey and it's different for everyone. And so calling Quitline or a service like The Zone is really important, because you may need support, particularly in that nicotine withdrawal phase.
Yeah, great. Okay, so Riona, typically how long does this withdrawal process last for, and how can we be supporting those around us who are experiencing withdrawal?
Like Sabine said, everyone's experience is individual, so there's no one set way to go about things. In saying this, as it was mentioned before, withdrawal, it usually begins a few hours after vaping or smoking, and within the first week is usually the toughest. And we can encourage young people to engage in more relapse prevention strategies in order to manage their cravings. Something I really love to work on with young people is a relapse prevention strategy called the 4Ds. You can cut it down to 3 if you want, or make it up to 8. But in simple terms, the 4Ds stands for delay, de-stress, distract, and decision, or decatastrophize, depending on what way you want to look at it. So we write out a plan, and we talk about how we're going to delay. So we'll delay the action of vaping. Is that for a set amount of time, 15 minutes or more? That gives the craving a time to subside, and we know that cravings come on really strong and it can feel quite painful, and they just need time to reduce. So delaying the act is key. We can de-stress by lowering your stress levels by deep breathing. A lot of the time when we talk to young people and we talk about breathing techniques, they're like, please. One thing I really love to talk about is when you were vaping, you were taking that deep inhale and a big exhale. Let's try and do that together now without the function or the use of the vape. Yeah. And understanding that, they can use those breathing techniques to actually regulate themselves. They can distract themselves by engaging in an activity that occupies their mind for a bit of time. So this could be something like walking, it could be listening to a podcast like this one, or listening to music, watching a TV show or a movie, journaling, anything that kind of works for them. Sometimes this can be the hardest part. People don't know what distracts them best, and this can be a big part of their learning as well. And the last step is to make the decision or decatastrophize what's actually going on. So after you've done this delay, after you've tried to de-stress and distract, you can make an informed choice on whether you want to act on your urge to vape or not. You consider the pros and cons of acting on the craving and remembering and reminding yourself why you wanted to quit in the first place. Soothing and supporting yourself and reminding yourself you've got this. We can really support people by being there for them and holding that non-judgmental space for sure.
Yeah, great. Okay, so after learning about what this quitting process looks like, it might be difficult for some listeners to understand why people might start vaping to begin with. If it's so hard to quit and if it's so addictive. Sabine, do you reckon you could touch on that a little bit for me? Why might young people be starting to smoke or vape?
Look, I think you touched on it really well in the previous episode with Rachel and Alicia. when you talked about the big tobacco, there's been an absolute targeting of young people. There's no doubt that when vaping was introduced to the Australian market, the flavours, the colours, the way it was packaged was all aimed at getting a new generation of young people addicted to nicotine, and that was to line their pockets. So there's definitely that element, but I think there's also the usual elements why people indulge in certain things. Trying to combat stress is a big one. We know that people often feel that vaping helps with stress, although that's actually contradictory to the evidence. That's something that sometimes people will raise. We also know that if you are around people who smoke or vape, that you're more likely to. If it's something that's seen as normal in your kind of in your group, that's one of those things that can really lead to vaping as well. Certainly in the past, having access to vapes in every single store on the way to school was certainly an issue, and thankfully those federal reforms are going to really impact that exposure. But we also know, of course, just being a young person, you kind of that peer pressure, that really wanting to fit in, wanting to try new things, risk-taking that's sometimes normal for some and not for others. They're all reasons that people might start to smoke or vape. I think also, let's not kid ourselves, we used to not see smoking or vaping on TV anymore. I've really noticed recently, I've watched a few shows, you can see people smoking on film again, which is really interesting. But certainly social media has really glamorised it to some degree, and I think there's no way of avoiding that when you're a young person. And then, of course, there's people within our community who have extra stress due to potentially being from the rainbow community, so people who are LGBTIQA+, who already are dealing with extra discrimination and social anxiety, rejection from loved ones, all of the trauma that goes with that. And of course, people from the Aboriginal and Torres Strait Islander community who are dealing with that intergenerational trauma. So lots of reasons and lots of diverse experiences.
Yeah, definitely. So one of the first things you said was stress, that young people are often turning to vaping to relieve their stress, although we do know that it actually makes our stress and anxiety worse. Riona, in terms of the quitting process, does this involve promoting alternative coping strategies to sort of deal with that stress to begin with?
Yeah, as mentioned before, a lot of relapse prevention strategies really focus on that, reducing anxiety and soothing, but there's other things that young people can engage in to reduce their stress and anxiety, and that can be things like engaging or re-engaging in meaningful activities such as sport, art, pro-social activities that make them feel connected. So that can be connected to community, to family, to faith, to culture. A young person, and I love journaling personally, and I really encourage young people to do it, but journaling is a wonderful way to track and reflect on their experience and of their dependence and their progress. It's a really, it's a physical thing that you can refer back to and see how far you've come and what things have worked and what things haven't. Young people might engage in exploring using sensory items to self-soothe. I know that's been a really big thing in the work that I've done with young people. So that can be simple things such as like a lollipop, blowing bubbles, using sensory toys and engaging in those things to reduce stress and anxiety. They might engage more in, somatic practice such as deep breathing mentioned before, that mimic the function of the vape. I think that can really help, de-escalate the way that we're feeling and self-soothe. Yeah,
great. Okay, so if I'm understanding the AOD process correctly as well, I know that services are often available for the person themselves as well as their family. How can parents get involved, or important adults in someone's life, get involved to either help promote these sort of healthy coping strategies or help the person to access support and quit and everything like that?
Yeah, I think having protective adults, parents, caregivers in a young person's life is one of the most important things. I think it's important to understand developmentally what a young person is going through their adolescence and how the adults in their life can support them, because I think it's, a really hard time, or it can be a tricky space to navigate. So yeah, parents can really support young people to obtain like a sense of meaning and involvement. So, the family or caregivers, adults provide love and support. They provide good, clear communication. Young people, they can encourage young people to engage in purposeful activities and a constructive use of time. So encouraging young people to be creative, engaging in programs, whether that's youth programs, time at home, religious and community engagements, and engagements in sport, things that are meaningful to the young person. And encouraging a young person to care about themselves and others is a huge one as well. And families, adults, supporting young people to develop the ability to manage themselves, so forming a positive identity and a personal power and a high sense of self-esteem and a sense of purpose, and really encouraging young people to engage in community and be perceived by community as valuable participants in that as well. Yeah, okay. So do you have any examples of like positive parent involvement throughout this process? Yeah, plenty. So parents and caregivers, as I mentioned, are one of the young people's biggest support systems, and they can have a huge impact on the young person's recovery journey. So holding a non-judgmental and having robust conversations with young people about the function of the young person's substance use, and to work with them collaboratively on how they may manage urges and cravings, usually creates great outcomes. I've witnessed parents and children go through the quitting journey together, and I think that's been such a powerful experience for both the parent and the young person. And it's something that's brought them closer together and having, a good understanding of each other. I think in this space as well, it's really important to remember that if you are a parent on a recovery journey with their child or young person, it's not a linear process. A lot of times it will feel like it's 2 steps forwards and 3 steps back. But in these spaces, it's important to remind ourselves as a parent, caregiver, adult, that every step back is an opportunity for learning about what worked and what didn't, and what could be approached differently in the future.
Yeah, and it sounds like as well, almost if you're watching your parent go through that process of quitting, it could be really quite, like you could really admire them for going through all of that.
Absolutely, and it speaks to that role modelling as well, and capacity for change and stuff like that. I think it's really cool. Yeah. So what are some tangible things that parents can do? As I mentioned before, they can be a good role model. So like we spoke about before, like going on the quitting journey together or quitting can be a great demonstration on that it is possible and that change is possible as well. Being involved in their lives. So setting up a routine where you're regularly spending quality time together. That could just be sharing a meal together. It could be helping them with their homework, just showing a genuine interest in them and the things that are important to them. That might be their hobbies or whatnot. I think it's really important for boundaries as well, like, setting rules and expectations around drug and alcohol use or vaping use and stuff like that, and discussing these rules together and including consequences for breaking those rules. I think boundaries are still really important in these spaces, and making time for them. So letting them know you're ready and willing to talk and listen. Listen is a big part. Speaking together, just, not trying to lecture them. I know it's really hard not to sit in that space, but instead listen to their thoughts and concerns and offer that help and support. Yeah. So it sounds like a big part of the parent's role is to just really be there as a safe space for the child. This isn't even necessarily to do with vaping anymore. It's almost become a parenting podcast. But yeah, to be that role model and be involved in the child's life, so that if the child needs to go to them for questions or support about anything, vaping or otherwise, they know that their parents are there to support. Absolutely. Yeah, great. Okay, so passing over to you now, Sabine. What support can Quitline provide for parents who have a child who is addicted to vaping?
So Quitline can really help to support the parent by making sure that they have the most current and up-to-date information around quitting and vaping and the dangers and the risks around it. And because Quitline is a therapeutic and confidential service, we don't necessarily share individual stories, but we certainly know that we've had contact from not just parents but teachers as well in the community, as well as carers and siblings or friends even of people who smoke or vape and who are just worried for them. They can see that what impact it's having on their loved ones' lives and are really keen to support. So Quitline is very happy to support anyone with that type of request or need for information. And we have had children as young as 13 contact Quitline in the past. And I think what really resonated for me from what Riona was saying was that really that keeping that conversation going is what's really important. And so if parents have the information and then have some tips as well from perhaps the counsellors on how they could have those conversations with their own family, that's really helpful.
Yeah, great. So Sabine, my last question for you, how else can we prevent young people around us from starting vaping?
Great question, Rebecca, because obviously that would be the best if we were able to prevent everyone from even starting. I think it's really about all of the things that Riona's already talked to around open conversations, but it's really about making sure that they have the information at a stage of their lives when they're still open to the input of their parents and their ideas are still forming. So late primary school, early high school are those really crucial years. And at QUIT, we've actually developed a school curriculum resource, which is an aligned piece of work that students can participate in the classroom setting, and it teaches them about the manipulation of big tobacco. It teaches them about marketing tactics, and then they have to do a section where they develop their own initiative within their own school setting. And so it's a really powerful piece of prevention work that we're doing, and people can access that via vapingfacts.org.au, and in that same website they can also find information for parents and caregivers on how to have those conversations, how to really set it up in a way that young people are happy to share and are open to their thoughts.
Yeah, great. I just want to say a big thank you so much to both Sabine and Riona for joining us on this episode and sharing your in-depth expertise and knowledge. I really appreciate it.
No worries. You're welcome.
Thank you for listening to this final episode of the Escape the Vape podcast series. I hope you found the information in these podcasts useful and are able to utilize the tips offered by our expert speakers to support someone you know to quit or never start vaping. If you are looking for more information on the harms associated with vaping, visit the DPV Health website at dpvhealth.org.au/escape-the-vape/. The link is also in the description. The website